Good day. My name is Cheryl Parker. I'm a registered nurse, and my specialty is clinical informatics. And what I'd like to talk to you today about is a little bit about workflow in the clinical environment and really the barrier that technology has caused and what motion computing is doing to solve that particular problem of the barrier between us and our patients. So if you think about technology, back in our old days, we had our clipboard, we had our pen. That worked really, really well for point-of-care documentation, whether it's the bedside, whether it's in the lounge, whether it's in the patient's home. It's important that we document as quickly as we possibly can. Why do I say that? Well, if you think about the way we practice right now, what we're doing is we're working, and 6, 8, 10 hours, even up to 12 hours later, we sit down and we try to regurgitate out of our brains all the things we've done that day for our various patients. So what we really need to do is to move back to the old days of documenting at the point of care so that when we walk out of the patient's room, our documentation is caught up. Documentation is really an interesting phenomenon because we collect little bits of data all day long. Some things are very big, such as an admission assessment, and some things are very, very small, such as a pain score or an I&O reading. So what we've really tried to do here is to look at the workflow and say, how do clinicians work? And think about the different types of clinicians that we deal with. You have the Motion C5, a tablet, and that's good for certain workflows. But there's other workflows in which a cart was really more needed, such as an admission assessment or a very large medication pass. So what we want to talk about a little bit today is what we've done to create that mobile ecosystem. What we put our engineers to work on is a new cart that works in conjunction with Motion C5 to really give you that whole ecosystem. One of the biggest complaints that we heard from all clinicians was the problem of battery management. There is nothing worse than listening to a nurse who's just gone in to do an admission assessment. She's on screen 7 of her admission assessment, and the battery goes out unexpectedly, and all the work is lost. So what you really need to do is have battery power that you can depend on. So one of the first things that our engineers looked at was power management. One of the things that we created was the on-screen dashboard and the actual physical dashboard where you can read your battery here. And it's not just 4 lights. There's a whole series of lights from empty to full, and you can actually rely on this indicator. Because what's happening, and don't ask me how it happens, but they're actually sampling the batteries that are in this device. As batteries get older, they don't hold a charge as long. And so what used to be full at 4 hours is now full at 2 hours. But with the system that motion engineers have created, they're actually sampling the batteries that are in the device as it is, and full means full. And it will tell you, is it half full? And you can believe it. You won't go into a room thinking you have 3 lights left and you should make it through whatever it is your work is and not be able to. And if you really want to get specific, you can actually go to the on-screen battery management system that will tell you exactly how much time you have left either to charge when it's plugged in or how much time you have left on your battery if it's unplugged. So let's talk about variability of workflow. As clinicians, we do a lot of different things during the day. And one department doesn't work the same way as the next department. One unit doesn't work the same way as another unit. And even one individual doesn't work the same way as another individual. So that's where the combination of the Motion C5 plus the clinical workstation can really be effective. Let's take, for example, medication passes. Well, there's really 2 kinds of medication passes. There's our standard routine medication passes that we do. Depending on our floor, it may be a few meds to 4 to 6 patients. Other floors, it may be 20, 30, 40 meds to a single patient. So How do we want to create an ecosystem where I can work the way I need to work? So, one of the things is the cart itself. You can design it the way you want. It can have a single drawer, it can have multiple drawers, depending on how your institution is delivering meds to the patient bedside. The other thing is, you can choose to use it as the cart, and if you'll notice on the back, the C5 is actually acting as your CPU. So I can use the cart for my major med pass, but when I'm ready to give just one med down the hall, I can simply remove the C5. I'm still up, I'm still logged on to the system. I can now use it as my med tray. That's fine, it was built to take that. And I can now get my meds, go to my med room, go get my meds out of the dispensing unit, go down to the room. It's got the built-in barcode scanner, so I've got a barcode scanner with me. I can scan the patient wristband. So when I'm done, let's say I've given my med, I've barcoded it, everything's done with my PRN med, and I get back and they say, oh, Cheryl, you've got your admission assessment to do. Well, admission assessment, you know, the ones I were doing was running anywhere from 30 minutes to an hour. I preferably want to sit down. So I could take my C5, put it back on the cart. It'll come up on the screen. I'm back in business. I didn't have to log on and log off. I can now push my cart into my room. We can lower it down for us short nurses. We can raise it up pretty high for the tall nurses. Lower it down, have a chair, sit down, use my keyboard, do my assessment, and then maybe I'm just going to go do pain rounds next, and I don't really want to push my cart down the hall for pain rounds. I could take my C5 off and be completely mobile again. So it's really about choice. It's really about variability. How do I want to work? How does my workflow need me to work? And I get to choose.